On behalf of the 26th SMS UK committee, welcome to the annual pre-employment grant talk. We have with us tonight 10 successful recipients of the PEG, and I'd like to take the opportunity to thank each of them for taking the time to speak with us tonight. So the PEG is a grant given by the MOHH that covers 60% of the final 2 to 3 years of tuition fees of successful applicants. So in tonight's discussion, we hope to focus specifically on the application process of this grant, and we hope that this would provide the would-be applicants the up-to-date information on the latest application cycle and how best to prepare for it. So without further ado, before we jump to the questions, could I get our panelists to introduce themselves? So first being Rachel.
Should I go? Hi, I'm Rachel. So I'm from Imperial and I'm in year 5.
Second being Ming.
Oh, sorry. Hi, I'm Ming Yi. I'm a 5th-year medic from UCL.
Hi, I'm Lizzie. I've just graduated from Imperial.
Hi, I'm Justine. I'm from Barts. I'm a year 4.
Hi, I'm Ziba. I'm from Barts and I'm in year 4 as well.
Hi, I'm Daphne. I am from Imperial, 4th year.
Okay,
Hi, my name's Bridget. I'm a 5th-year medic at Cambridge.
And hi, I'm Satish. I'm a final year at Queen's University, Belfast.
Okay, great. So these are our panelists tonight. And for those viewing at home, there's a Slido link that we have set up. It's available on our Facebook page. If you have any questions, you would be able to post them there on the Slido link, and our panelists will be able to get to answering them at the end of this talk. So our first question, jumping right into the question, is to our panelists. Why do you think you are a successful PEG applicant? You know, any time to an elective, or there's certain things in your CV that made you a better candidate? Or do you think your grades played a part in this?
Okay, hi, I'm Rachel, so I'll start. Okay, so I think I'm a successful applicant because I think mainly, in my opinion, the interview is the most important. So during the application process, you will have to submit things like your grades, you need to give a personal statement, you need to say what kind of electives you've been on. But in the end, I think it boils down to the interview. So for me, actually, I applied twice and I was not successful the first time, and I was successful the second time. And to me, the biggest difference was the interview itself. And I think during the interview, they basically give you a clinical scenario, which we can tell you more details later. But to answer the question, I think I was successful because in my second interview, I was just a lot more confident in the questions that I was answering. Yeah.
Great, yeah.
Can I add to that? I think alongside being confident is also they want to see how you think on your feet. So often they want to see you thinking out loud or thinking through the process of reading your ECG or whatever scenario they give you, versus just kind of sitting there and not saying anything if you're internally processing. So it's very much about showing them how you're thinking so that they can actually see, yeah, like what kind of doctor you'll be, even if you don't really know the answer to the actual question. Yeah.
Mm-hmm.
So how about for the rest? Why do you think you are a successful PEG applicant? I mean, everyone's interview is different.
I would agree with Rachel, I think, because in my application, in the CV itself, I don't think I literally had nothing on my CV. Like, so as not to leave the box blank, I just put something about some language I was picking up, you know, but there's absolutely nothing. But it was just the interview. So it's really just showing some level of competence at the interview, being able to vocalize medical concepts and not just, answering questions. And at the end, I think they really wanted me to show a understanding of the differences between what working in Singapore would be like versus in the UK. Because they were asking me what kind of electives I had done in Singapore. And when I said that I had done something in NNI on a neurology ward, they were quite happy with that, because I told them about how long the ward rounds were in NNI. And I thought they seemed to think that added some kind of maturity to my understanding, that I knew what I was getting into. That I wasn't just making this decision too lightly, because I think it is quite different from the UK, how things are in the UK and in Singapore. So you need to just demonstrate that you understand that.
I do think though, if you have a strong CV, it will help, because that gives them more material to talk about in your interview as well. So if you can bulk up your CV with like research or audits or work experience or whatever it is, it does show that you are also very like a keen medical student, and they also have more stuff to question you on. But yeah, the thing about differences between the UK and Singapore came up in my interview as well. So it seems to be a common theme.
So did any of you do electives during this, during your time before you applied for this PG? Do you think that helped, or was it asked during the interview?
So I actually didn't do any electives in Singapore, but they asked me, like they strongly recommended me to do one before coming back. I don't think it really matters if you've done one, because I spoke about my experiences like doing preclinical attachments. So I don't think you need to have done that to do well in the interview, but definitely show that you are keen on doing one. So I said that I would do it in my 5th year. And then they asked me, how am I going to go about doing that? So I said, oh, I'm going to go on the NUS portal and like sort that out. So I think just show that you have interest in doing something in Singapore, seeing what it's like before, coming back to practice in Singapore.
I did one in Singapore, and I spoke about it in my interview. So I think they do kind of like to emphasize that applying for the bond means you do have to go to work in Singapore. So they kind of want to see you having like done some previous research into what like medical's like system is like in Singapore. So I would say it's good if you have done one before you apply, but it's not the end of the world if you don't. Yeah, just make sure that you kind of have like a good idea between like the differences between the UK and Singapore. Yeah.
I suppose for some of the people who haven't done electives in Singapore, it might be useful to point out that there really is a very real difference. Like in Singapore, they start incredibly early. Some places they have the concept of pre-rounds, where you go one full round of the ward before your consultant even comes. So if you've only been in the UK, I think you'll really get quite a shock. Although most of you probably would have heard about this from other people already. But if you don't, if you think it's going to be the same, then it's really worth asking around, I suppose.
Yeah, and I think that will help in not just a PEG interview, but it will help you decide also like whether you want to work in Singapore versus working in the UK.
I think for me, I didn't have any previous elective experience in Singapore. But actually in my interview, they didn't they didn't specifically ask me about it either. It's kind of just at the end of the interview, they just asked, like, why did you want to come back to Singapore to work, and things like that. So I think in general, they just want to see that you have interest in coming back, and I think that will affect like their judgment.
Yeah, I think I've never actually done an elective in Singapore for medical reasons, and I'm starting work in very soon. But I don't think I think it is useful to know, but I think it's more appreciating that they want to see that you do want to come back and that you have valid reasons for wanting to come back and that you are interested in doing the elective if you haven't had one done already. But obviously, if you can do one, it'll be helpful. Either that, or I did more kind of like research-based electives in Singapore. So I think that still helped to show that I was like interested in like the Singapore healthcare system anyways. Yeah.
So some of our members have actually asked about grades. So regarding like preclinical and clinical grades that you have had before applying, do you think that plays a factor in making you a more successful applicant in the PhD cycle?
Well, I mean, I think I obviously think if you have like really good grades, it's going to look good, which is more helpful. However, you don't have to be a top student. I'm not like a top student at uni, you know. You can be an average student, but if you can show that you can think critically on your feet and answer their questions in a way that is useful to being a doctor, that's what they want to see, I think. So I think it really boils down to how you perform in the interview. In the same way, if you're a top scorer and you can't answer, if you can't show that you can think in the way they want you to think in the interview, then they're not going to pick you anyway. I think it will help if you're really good, but if you have a strong interview, I think that's way more important.
Yeah, I think I'm quite average grades-wise as well. So it's nothing, I mean, if that reassures anyone.
I mean, from what I understand, they don't really place that much emphasis on grades. It's more just making sure that you're passing, I guess, because at least as far as I know, they grant interviews to most people. So I think that's the only thing they look at for grades wise. And then everything boils down to interviews. So, you know, if you don't do that well in school, but like if you can answer well and know that you are strong clinically, then I think at the end of the day, that's what matters. Like they really do look a lot more at interview than anything else. Like from my interview, I just assumed that because you write a personal statement, but I think they just scanned through my personal statement literally right before I walked into the door. So it's not even like, it's very, you know, they don't really put that much effort into looking through like who you are as a person, like in your background. It's just more how like you react to their questions, yeah, and the scenario they give you. So yeah.
Someone asked what's average. It's like literally 4th and 5th decile, like literally average.
I think, I don't know if it's changed, but in my year, which is 3 years ago, 3 years ago, there was like a box for your supervisor to tick whether you were in like the top 20% of your year or not. Mm-hmm. I don't know if that's changed. Has that changed? Is that the same?
Yeah, we have that.
Yeah, so I think they look at that. I think it's so I don't know if that kind of divides it into whether you're top 20% or just not top 20%. I don't know if that helps, Lauren. You in answering like what's average, but
yeah.
Great. I think that answers that for questions about grades and what makes a successful applicant. So basically, I think you mentioned that, you know, it's great to have a CV that looks good. Not necessary that you have electives, but it really depends on how you perform during the interview itself. And I think most of you mentioned that having a good interview performance is one of the key things. And so we'd just like to move on to like the structure of the interview. So could you share with our viewers how your specific interview was structured? I understand that each interview might have been run slightly differently for each person. So it'd be great if everyone could give a take on how the interview was structured.
All right, so my interview, I think first I just went in and they were very kind at the start. They took some time to let you calm your nerves. Like they asked you random questions. They asked me about like JC and army and things that I never even thought about for such a long time. But they ask you some nice questions first, you know, ask you how you're doing. And then they get down after that to the medical things. So I had heard from seniors that they like asking you to present a case to them. So the first thing they asked was just to exactly that, you know, just present a case. So I already had something in mind, you know, I presented a cancer patient with myeloma. And after that, they just picked out things from whatever you present. I don't think they really care how thorough your presentation is. They just want some material to go off on and ask you about that condition. So you really need to, I mean, it's wise, you know, to pick something that you know about, but I think you shouldn't pick something too simple that wouldn't really impress. Like if you just did something like a hypertension patient, it would be really boring. So just pick something that seems complicated, but that you know pretty well. So yeah, they just asked me why I chose this case. I said why it's interesting to me. Then they asked me some questions about it. After that, they just went completely off on a tangent. They asked me about pancreatitis, everything about that, just what is it, what investigations, what treatment would you do? They asked me the etiology of it, how would you determine what the prognostics are like? And the questions just kind of get progressively harder. So I think they're trying to reach a point where you don't really have an answer, and that's really fine. Like they were asking me about why calcium is low in pancreatitis. And, you know, it's stuff that you kind of might know, but you can't say for sure. So they just want to hear you think out loud. And then after that, there was a data interpretation thing where they gave me an ABG, and it was hyperglycemic, hyperosmolar state. Is that it? And with metabolic acidosis. Then they just asked me some things about that. And yeah, it's really just reasoning on the spot. It's really okay to take your time. I think they just want you to see you think things through. And they're really very kind, I thought. If you're going the wrong way, they will prompt you. And they will kind of point you back to what is pertinent and ask you about that directly. Like if you're not getting the question, they would direct you back and ask you. So unless you really don't know the answer, you can't really lose your way. Yeah, and then after that, we just talked about electives. Did anyone do the same station?
I'll say that all three of my questions were very much just three sets of different kind of clinical cases that they wanted me to kind of discuss with them. I didn't really have any kind of non-academic questions, but I would kind of really reiterate the point that if you're going to bring in a case, it's important that you know all aspects of it, because they are going to ask you additional questions about it. So you want to know it well, you want to know the various aspects like the investigations, the management, and kind of the side effects of each management and stuff like that. So you go in prepared in that sense. There is also, in my interviews, there was an element of data interpretation as well. So kind of just knowing that ahead of time and being prepared for that, I think is important.
Yeah, I think mostly from what I've heard as well, for my own interview and from what I've heard from friends, a lot of the cases are generally like quite acute cases, like acute medicine things. So for me, I got like an ECG Some friends got a chest X-ray, that kind of thing. So that would be good to like look over, I think, before the interview. And for me, it was same as Mingy as well, that they asked me to present a case from one of my rotations. So when I went in, they asked me what rotations I'd been on. And then they told me to just present a case that I thought was good for teaching and had good learning points. So then I just presented it, and then they just asked me about it. So I think when you're preparing for it, just prepare read up about the condition and think about differential diagnosis as well. Like they want to like test your thought process a lot of the time also. It's not kind of just question and answer, like they also do want to see how you're thinking. So even if you really don't know what to say, like you don't know the answer, don't just say I don't know, like try to think through your thought process. And another thing also from one of my friends that I heard was that just maybe prepare 2 cases just in case, because she presented one case and then they didn't really like that one, so they asked her to present another one. So just when you're preparing, like it would be good to have like a backup. Yeah.
I think for mine it was quite similar, except that they weren't as nice in the beginning. They just kind of jumped straight into asking me like what rotations I've been on, and then just to present a case from one of my rotations. So I think I spoke about someone with familial hypercholesterolemia. Then they asked me like management of that, and then they were like, "Do you know what statin she's taking? Like, do you know what the different types of statins are?" And I was like, and they were like, "Do you know what dose of statin was?" And I was like, "I'm sorry, I honestly don't know." So I think, so it wasn't that amazing an interview either. But besides that, then they gave me an ABG to interpret as well. I also got like something that was kind of showing DKA, so they asked me about that. They asked me about some other parts of the ABG, and then kind of went through management for DKA. And then I think finally they kind of asked me why I even applied for a 3 MOH grant, because it's quite long. I mean, the rationale there is quite long, so they wanted to, I guess, like know that I really did want to come back to Singapore. So I think in that sense, it's helpful if you've done an elective in Singapore, or like just done any sort of medical experience in Singapore, to kind of link that back in and just show them why you want to come back. Yeah, that's how mine went.
I do think they try to push you, like Mingy, you were saying. So if you're probably like doing well, they're probably going to ask you harder and harder questions. So I think, and they may also, I don't know if it's changed, but they may also pick up on what you said in your like CV or personal statement. And for example, in terms of mine, like they said that I said I was interested in cardio, so they gave me an ECG, which was just like AF. So, and then they asked me about management of AF, which is fine. And then they gave me a harder ECG. So they may build on that. And my friend who also got it said he was interested in endo. And then they therefore asked him a lot of really hard endo questions in his interview. And yeah, in mine, they randomly just switched to talking about like parathyroidectomies and like risk factors. I mean, what like indications and complications of the surgery, and like what structures, like anatomical structures border like the thyroid, and like what are the risks in surgery, that kind of thing. So it was just really random, but yeah.
So one of our viewers has asked, Noel Chung has asked, how much specialty knowledge, for example, ENT and pediatrics, are we required to know as applicants? Will we be required to know about specialties that we haven't rotated in? Satish, would you like to answer that?
Yeah. So I think in terms of knowledge, specialty knowledge wise, they kind of focus on more internal medicine kind of rotations. I haven't had any friends who are asked on ENT specifically. In terms of rotations wise, it's quite unfair to ask rotations that you haven't done, which is why they kind of ask you right at the start what you have done and what you haven't. But I had seniors who did have questions that they were asked that they weren't rotated in. So It's a difficult question, but I think you can kind of tell them as well you haven't done the rotations, and I hope that they think it's fair enough to ask a different question.
So my interview was quite similar to what everyone else has already shared, but for me, they didn't really introduce themselves. They sort of just straight went in saying, how come you chose to study in the UK and not Singapore? And then they said, oh, did you apply for NUS? Did you apply for NTU? And then I said, yes. And they're like, how come you're not there? And I said, I didn't get in. And then it was just like one question after the other. Like, they didn't really ask me about my personal statement. It was more like, they're like, oh, you did netball, cool. Like, they didn't really ask much about that. And then they said, share with me a clinical case. So I presented about Graves' disease. And then they showed me an ECG about AF as well. And then from there, they sort of just branched out into cardio, which I didn't really prepare for. I revised like hardcore endo stuff. So I wasn't really prepared for the cardio stuff that they were asking me. And also, like other people said, they will just keep questioning you until you reach a point of like you can't answer anymore. So at that point, I think it's okay to say that you don't know, but suggest how you would come to that answer. So like, instead of just saying, I don't know, and that's it, try to explain stuff that you do know. So for me, they asked me like a very specific question about Lugol's iodine and how it works. So, and what they wanted was like the molecular mechanism of how it works, which I obviously wasn't sure about, but I just said, oh, it blocks the something about conversion of thyroid hormones. And I think like just saying something rather than nothing like was enough to satisfy them. So just be organized in giving an answer instead of just leaving it as that you don't know. Yeah, there wasn't really much else that they asked other than my case and the data interpretation. It was quite quick. Yeah.
Someone asked something about surgery. That's such a specific question. I mean, they might do, you know, but I think like what people said, most of the questions would revolve around internal medicine. If they won't suddenly test you about like consultant specialty knowledge, that just doesn't make any sense. So maybe they might ask just to see if you know anything about it, but I think you can't be penalized if you don't. So really just focus on on medicine stuff.
I'd just like to add that they can ask you questions on like anatomy related questions because that's supposed to be what you've covered in preclinical. So that aspect of surgery might come up, but I think in terms of the actual techniques, it's less kind of core knowledge that you're expected to know.
Mm-hmm. They might provide in terms of cases for you as well. So they actually gave me a scenario and then they started asking me about differential diagnosis, management, etc. So, and pharmacology was also involved where they asked me the mechanism of the drug as well. So sometimes they may ask questions like that. And I think it's important that you also verbalize that you want to take some time to just think, because it's completely fine to take time to think, and it also shows that you're thinking rather than saying, I don't know.
Yeah, I think for my interview, because I didn't do it in London, so it was a bit different. So I didn't get any data interpretation for my interview. So it was basically just the case that I prepared. So at the start of the interview, they just kind of just went in with like, which placements have you done, like on which specialties? And then they just said, okay, please present something that you've seen on the ward or something. So I kind of prepared a case on like breathlessness. And then after presenting like the history and things, they'll ask you what's the differential diagnosis. And then you just, you say like what your differentials are, and they'll say, okay, so like for this differential, like what would you expect to see, or for this differential, what would you expect to see? And then from what you answer, they will kind of like lead on to the next question. So it's really based on what you say, and then that's how they just like determine what the next question is. And similar to everyone else, they just basically keep asking you questions and they just keep trying to like stretch your thinking. So a lot of times I felt like I didn't know the answer immediately. So I just said like, oh, sorry, I just like to have a moment to think about the question. Or you can say, or I tried to show them that I was thinking. So you can just say, like, I'm not too sure, but from what I've read or from what I understand, this is how it is. So possibly it could be this or something like that. So it's just kind of like to show them that you're thinking and not just shutting down when you can't answer a question. Yeah.
Someone has asked, what are examples of data interpretation questions that they ask? Would anyone like to answer?
Yeah, so in terms of data interpretation, they actually asked me about a ABG, where they actually give you the results of a particular ABG and they ask you to diagnose it. And after which, then they ask me about causes of, for example, metabolic acidosis. And I don't know if they expect you to know the difference like raised ion, normal, and low ion, anion levels, but just mention those as well. Sometimes they can ask you spot diagnosis of ECGs and X-rays as well. And these are very common things that they can ask, and it's very easy for the interviewers to also get examples to test you on them as well, to have a good knowledge about how to know your ABGs especially.
Yeah, they also gave me an EVG and then asked me to interpret it. Sometimes they can be quite like intense. So they told me like, okay, take 1 minute to look through this EVG and tell us what you think. And I was looking at the EVG and then I was just thinking, not saying anything. And then they were like, the EVG's on the table, can't you see the EVG? And I was like, oh yes, sorry, just give me 1 minute to think about it. And then they were like, okay, your minute's like ticking, so like I hope you don't take too long. And I was like, okay. So yeah, I think they try to pressure you and see how you react under the circumstances. So it'll be good if you revise your ABGs and chest X-rays and ECGs, so that when you see something, you can be quite comfortable with it. Yeah, and then just be familiar with some of the very common conditions. So AF for ABG, I got DKA. They asked, and then they moved on to like honk. They also asked me some other, because I think I had acidosis, so they asked me like, what are other causes for acidosis? And I think they can also ask you quite specific questions relating to the ABG or to whatever modality you get. So I would be prepared for that and just revise and read up on that. Yeah.
So another question is that's commonly asked is, how has the process or type of questions changed over the years to your knowledge? In the past, if I'm not wrong, there would be less clinically related questions. Is there a difference along the years of how these interview questions have changed regarding the PhD cycle?
So when I first entered Queen's University Belfast in 2015, I had a senior who graduated then who took the PhD, and she told me that her questions were very about me kind of questions. So they started asking about life before university, why she was interested in medicine, and was she willing to come back, and has she done elective? So it's very open questions, non-clinical questions, whereas my interview, the about me section was 30 seconds or less. It was just where are you from, and which university you're studying in, and it went straight to clinical questions, which I think the rest of the panel are also having similar stuff. So there's definitely change from less non-clinical questions to lots of clinical questions, because I feel like they've reached a point where there's quite a lot of doctors as well in Singapore, so they're trying to just pick students who are clinically inclined as well, and mix and would suit the local community as well in terms of working in Singapore.
So another question by our viewers is, what do interviewers look for in candidates? Do we need more of the depth of knowledge or the breadth of it? What exactly do they look for?
So I think in terms of knowledge-wise, it's quite difficult because as the panel have mentioned, everyone has a different set of questions. So I think it's quite unpredictable what you're going to get. But doing electives, research, audits, and when you mention them, it gives you a level of advantage as well, because then they can narrow down to what kind of questions they can ask you, and it works in your favor because these are questions that you are strong at. So make sure that you build up on the cases that you potentially might prepare on as well, and prepare at least 2 cases because you never know what might happen. What's important, I feel, is the thought process, like what Elizabeth has also mentioned. They want to see how you think, rather than just going straight to the point, answering one diagnosis, which is very unlikely in terms of cases for patients as well. Think of possible differential diagnosis, how you would make sure that you can rule out or rule in possible different diagnoses as well. It shows and it helps you as a doctor in the future as well to think of what are different possible causes for this patient and how I can try and narrow down the possible causes as well, which is what they want to see in doctors in the future as well. So I would say it's more of your thought process rather than the depth. They're not looking for the next professor. They're looking for someone whom they can work well with and know how to actually seek help if required, and also think of what are the things they need to do before they present to the senior, for example, what are the tests they've done, etc. Yeah.
I think a lot of the stuff is probably more on the acute medicine side. So things like ACS, like acute coronary syndromes, pneumonias, or like a lot of the acute stuff. So in your cheese and onion, like your green Oxford handbook, some people recommend going through the acute sections. And I think in terms of breadth and depth, you need a bit of both, because you need to know the breadth in terms of, like cardio, resp, gastro, neuro, like the basic kind of, you need to know everything, a bit of all the basic like main systems. But then for your differentials especially, but you also need to know how to do some basic management for each one. And then obviously the better you're doing, the more likely they are to push you, and therefore more go into more depth. So I think it's a bit of both.
So someone also has asked a quite interesting question. So what's the diversity of the panel that are interviewing you? So are they senior doctors? Are they young doctors? What's the profile of the panel?
I think most of them are probably senior doctors. At least my panel, so I had 3 interviews in my panel, and they were definitely all senior consultants, or at least consultants. I don't think there was any registrars that I came across, or any of my seniors who told me about them.
Yeah, my panel had 3 people as well. 2 of them were senior consultants, and the last person was just someone from MOH. She actually asked me quite a few non-clinical questions. So I guess like more about myself. So she asked like why I applied for the 3-year PG. What are my reasons for coming back? And yeah, so a bit more personal. I wouldn't say my interview was completely clinical. Yeah.
So thanks for answering the questions regarding the interview process and the structure of it. Now we'd like to ask a bit about, being a successful recipient of the PhD. Is it possible to delay coming back to Singapore for your housemanship? And what are some of the reasons for doing so or not doing so?
So in my case, when I went to sign the contract, I asked if it was possible for me to delay it by 1 year, because that's what I heard from other people. And the lady who was signing the contract with me said that that's fine, like you can do that if you want to, but only for 1 year. And then after that you have to come back. But I'm not too sure how that will work if you decide to intercalate after you sign the contract or things like that. Like that one, I'm not too sure. So if anyone else can answer that, that'd be great.
I think you can take, I'm not sure about intercalation either, but like the 1 year, you can choose to do it abroad, but the only difference is that it doesn't count towards your bond. So if you, because your bond, if you take the PG, you're bonded for 3 years, I think. So if you do it abroad, your first year wouldn't count. But if you do it in Singapore, it does. So that might be effective for some people.
So I'm actually taking a year out. So I'm doing my first year in the UK. So as what Daphne has mentioned, it does increase your bond duration. So mine, since I'm taking a 2-year grant, mine would be a 4-year bond. If I did my housemanship in Singapore, then it would be 3 years. So some people might consider the bond duration as a factor of whether to stay in Singapore or not. And I know friends, I don't think there's a right or wrong answer, like to put up front, first of all. So I know friends, for people, family is important as well. So some of them decide to stay a year in Singapore as well, like right off the bat. I would like to get the GMC license and just kind of experience what the UK's kind of healthcare system is like as well in terms of working. So I decided to stay for a year. And one factor that I considered is Singapore does 6-month rotations. So you do 2 6-month rotations each year. Whereas in UK, it can be 6 months or 4 months rotation. And I could do rotations that I was interested in and that I would like to explore. So that's one of the other reasons why I decided to stay on to do a year before coming back as well. Yeah.
So someone has asked, if you want to return to the UK after completing your PEG bond in Singapore, will you have to restart as an F1? So you would like to answer that?
So I think that's a tricky question as well, because I tried looking around things, because F1 is definitely a requirement in the UK. As what I've realized, you get your full license, your GMC license, but if you have not completed your F1, I think you probably do have to start back from F1, because I remember hearing some internationals working in the UK who came from other countries. They had to get their full license, so that they weren't working at, for example, in their home country where they are consultants, they weren't working as a consultant in the UK. They were working at a much lower position, just to work for a year or two just to get their GMC license and then apply again for their particular positions that they wanted to. But if you've done your F1, once you get your GMC license, it's valid for 5 years, and then after which you would have to revalidate the license. So if you plan to go back after F1, assuming taking a 2-year grant, you've finished 4 years, I think it would be just nice if you are planning to go back to the UK after F1. But in terms of whether you need to do F1 again, I think likely, but if you've done your F1, I don't think you have to repeat your F1 again.
So someone has just asked about, will the PEG be open to dental students this year? Is the process the same as medicine applicants? I think I can answer that. To my knowledge, there is no PEG for dental students. I think that has been shut down a few years ago. And they used to give it to dental students in the past, but not anymore. All right, so regarding hospital allocations, so are applicants' choices for hospital allocations considered, or are they random? So hospital allocations being back in Singapore.
I can answer this one. So I think once you've signed a contract with MOHH for starting work, they will usually give you a list of the hospitals, and then you can like choose the ones that you're interested in, or the ones, and including your what do you call it, the rotations you're interested in as well. But whether you actually get that is not as a transparent a process as in the UK, where it's a very transparent, you're ranked alongside everyone else who are vying for the same positions. I'm not sure how they actually rank it, but you do have a choice where you can indicate what you would prefer to have in terms of hospitals and rotations.
Adding on to what Elizabeth mentioned, so I spoke to some of the MOHH staff as well, and they mentioned that because when you enter back to Singapore, you're under a provisional license. So in order to get your full license, there are some requirements that you have. For example, completing like 6 months of internal or year of, there's quite a combination. So you have to do some degree of internal medicine as well. And they mentioned that they may put you at a higher priority for internal medicine, but you might not know what particular rotations within internal medicine that you might get as well. So it all depends in terms of variability as well.
There's a question about how easy is it to get a GMC license after finishing consultant training in Singapore if you do want to migrate?
So could you repeat the question again, if you don't mind?
I think someone who is doing called Wenhao has a lot of noise that is in the background. So if Wenhao could kindly mute his mic, that would be great. So the question again is, how easy is it to get a GMC license after finishing consultant training in Singapore? Example, if you want to migrate.
That's a tricky question because as of now, of what I've heard from MOHH, they are in the process of transitioning all their postgraduate exams to MEd. So every particular specialty is going to be MEd, anesthetics, MEd, GP or something like that. Whether or not these postgraduate qualifications gets recognized by external countries, it's questionable, but you may be still able to do the postgraduate exams of the relevant countries like UK, MRC. So while doing your residency in Singapore, you can still attempt to do the exams such as MRCS, MRCP, or FRCS, FRCP, and then have these qualifications to apply for a position in the UK or Canada or etc. But the reverse is not possible, where if you are in the UK, it's harder for you to do the local exams like the MEd exams, because I remember speaking to NUS before, and they mentioned that some of their programs like MEd anesthetics is only available for residents. So which means you have to be a resident anesthetic resident in Singapore to do the exams. So the advantage of doing a residency in Singapore is you are able to do both the local and the overseas exams. But if you are training abroad, you may not be able to do the local exams in Singapore, depending on which specialty it is. But there's definitely a move to switch all the postgraduate exams in Singapore to MEd.
Can I add to that? So if you're thinking of migrating back to the UK, the first thing you need to do is get your GMC license. So for that, I would go onto the GMC website where they will, there's a lot of information there about this sort of thing. And I think you would, and I don't know what it would be like if you're a consultant, but if they do recognize like your house, or I mean, basically, if you do your housemanship in Singapore, you can still be valid for getting a provisional license, and AKA go back and do your F1 again. There will definitely be something on the website, the GMC website, about if you're kind of looking to go back after consultancy as well. But you need your GMC first, so.
Yeah, so I think that's best to check with on the GMC website for that also. So regarding coming back to Singapore, actually, so one of our viewers has asked, does holding a PG, being a successful applicant of PG, affect your career progression in Singapore? Would you find yourself at an advantage compared to someone who's returning to Singapore, being a non-PG holder? Rachel, would you like to answer that?
Yeah, so to my knowledge, anyone can add, but I don't think so. Like, I don't think it puts you at any advantage. And I mean, the contract also does say that being a PG holder also doesn't really change your applications for like residency, and yeah, so basically they won't really take it into account. Yeah.
So also on the topic of coming back to Singapore, so another viewer has asked, what are some reasons you gave for coming back to Singapore? Will it be sufficient to give family as a reason? So I'm sure quite a few of the panel here are coming back to Singapore to work, I assume. So what are some of the reasons that you gave? Ziba?
So I'm trying to think of what I said, but I definitely mentioned that in the long term, I would want to come back to Singapore because of family reasons. And also for me, I said that I found it more meaningful to serve in Singapore rather than UK because I was born and raised here. They didn't seem to question me much on that. So I don't think you need to give something like a groundbreaking reason, you know.
Yeah, I think I also mentioned family because I think that's quite a strong reason in itself. Yeah, and if I'm not wrong, that was like the biggest reason I gave. I think it's a bit hard to justify that you prefer like the working conditions here. I mean, unless you really enjoy like a 100-hour work week or something. Otherwise, yeah, I think it's okay as long as you like speak quite truthfully and just sound like you mean it. Yeah, I think they do push you, or they do want to know that you are quite certain when you take the grant, at least for my, in my year, because I think they give out fewer grants nowadays. So they were trying to get me to, like, they were asking me why a 3-year grant? Do you feel like you're committing too early? You know, and then because I mentioned that, you know, Singapore does work a lot harder, they were like, oh, are you afraid of hard work? Like, are you willing to come back here and slog it out, blah, 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 kind of thing. So yeah, I think, you know, just saying family, it's kind of a reason that they can't fault you on it as well. So yeah, it's definitely a good one to start with.
What is it, Elizabeth?
Sorry? I mean, I think you can just be honest. Like, why are you applying for the PG? Like, honestly, because it's true. I mean, you want to come back to. I mean, for me, anyways, I want to come back to Singapore because it's my home. Like, I want to settle down here long term. I want to practice here. So, and my family's here. So that's why I wanted. That's why I wanted the PG. I want to come back and I want to serve fellow Singaporeans. And they were like, oh, okay, and they just moved on. So I think about why you want a PG, and I think the answer, honestly, and it'll come across in the right way if you're honest. So yeah.
I know everyone here, so some people on this panel would like to come back, but I know and understand some people also on this panel chose not to come back or would not be choosing to come back immediately to do their housemanship in Singapore. Could you walk us through the process of why or why not?
Yeah, so I kind of touched on it a bit earlier on. So I decided not to come back straight away because so I'm doing a year in the UK because I know exactly what rotations that I'm going to do. So it's mainly from a rotations point of view because I wanted to explore specific rotations which I could in the UK. And because it's the deanery I'm going, it's also a 4-month rotation. So I could explore 3 different rotations, whereas in Singapore, I wasn't exactly sure what I would get. And the added advantage is I get the GMC license as well. But obviously, I'll be coming back to Singapore. There have been rumors or people saying that when you come back to Singapore as a house officer, there are added advantage or the likelihood of getting into residency is higher. That's still very kind of questionable. I'm not exactly sure what is true, what is not, but getting into the system earlier, doing your housemanship in Singapore definitely gets you familiar with the system a lot quicker. Because if you finish a year and then come back to Singapore, you're coming back as a medical officer rather than house officer, so expectations will be higher and the learning curve will be a lot steeper. So there are some disadvantages to coming back a year later as well, but just be aware of the pros and cons. So I think the main disadvantage coming back a year later would be your learning curve is a lot steeper compared to those who come back as a house officer. But the main advantage for me is I get to pick exactly what rotations I would like to do and explore.
I think I'm on the other side. I've chosen to come back for my F1, so for my house officer year. And in that, I've kind of like, I guess, sacrificed getting my GMC in the first year. And I think a big pull factor for people staying in the UK for the first year is getting your GMC. And I think it's also up to you to consider how important the GMC is to you. Because if you're really thinking about staying here for, I don't know, for 4, your bond is 4 years, let's say you've hopefully gotten into some internal medicine or something by then. Are you going to stop your internal medicine training and go back to the UK at that point to restart as an F2 or whatever? As an F, wait, what would it be? As an F2 after you've gotten your GMC? Or are you thinking about only going back when you've qualified as a consultant 10 years down the line? So I think it's up to you to decide how likely it is that you want the GMC so that you can go back to the UK. And obviously, if you have other considerations, like you have some specific rotations or hospitals or something that's pulling you to the UK, that's a different matter. But I do think a big advantage, like Satish was saying, is that you get into the system a year earlier, which means that I don't think it's necessarily easier to get into residency as a house officer. It's because it's more like you get into the system earlier and therefore you're more used to it, and you have 1 year, you're starting to apply for residency 1 year earlier. Because if you come back as an MO, you only start applying as after you finish MO, whereas if you come back as an HO, as a house officer, you can start applying as an HO. So you kind of get like an added chance. Plus you get to make like connections and get yourself out there, get yourself known. So I think that's the advantage of coming back a year earlier. But this was a big decision for me. It's a big thing to decide about whether you want to stay or go for the first year. So yeah, something to definitely think about. Talk to your family, your friends, your seniors, your partners. Yeah, think about GMC.
So there's another question asked by one of our viewers. The question goes, if they are switching all postgrad exams to MMed and you decide to specialize overseas, is it still possible to return to Singapore as a doctor post-consultancy?
So I can answer a little bit of that. So if, for example, you have done several years, you have completed your consultancy in the UK, I'm just using UK as an example, and you're planning to come back, so you definitely not come back to Singapore as a consultant. They'll definitely put you at a lower position called associate consultant. That's kind of across, unless you are very famous or highly accredited, that's a different story. But generally, you come back as associate consultant, and consultancy is kind of a post. So it all depends on whether they have vacancies for you as well. If the particular hospital wants to take you in, then they'll take you in. So it's not a definite no, but there's a chance that you may not get a job back in Singapore if you apply for consultancy post after finishing in the UK. There's definitely a chance you may not get the job because it's all depending on vacancies. Yeah, that's all that I can help with.
Great. So yeah, I think that has been answered quite well. So regarding the number of housemanship intakes and the number of PEG grants given, does anyone know how many PEG grants are given every year? It's not known. How about the number of housemanship intakes every year?
I think the number of PEG grants is definitely on the decline. I think 3 years ago, it was, I think they told me about, they gave out about 20% out of the people who applied. I think 2 years ago, I think it was down, actually, I don't know. I think about 4 or 5 in total. Correct me if I'm wrong. I feel I'm a bit out of date. But in terms of like number of housemanship, that is, I mean, it's the intake of NUS, NTU, Duke NUS, and all the international medical graduates coming back. So, I mean, I don't know what number that is, but it's a lot of doctors. And I think adding to Satish's point, there are a lot of doctors in Singapore, basically, at the moment, which makes it very competitive to get into residency or even to become a consultant.
Mm-hmm. Thanks for answering that. So we would like to ask a questions now on the contract of the PG. So are there any contract terms that you would consider unfavorable towards a successful applicant or someone who has received the PG? Mingyi, would you like to share on that?
The ones that I know of are the fact that they kind of reserve the right to change the value of the grant at any point. They reserve the right to terminate the grant at any point as well. But that's just something that's written in there, but has never been enacted, obviously. So I don't think it's worth worrying about. Then other than that, I can't really remember what else specifically. There's something about not holding any other bursaries or scholarships. Does anyone else have anything? I'm not too sure.
You can't fail. Oh, sorry.
Sorry,
Yeah,
I was just, I think there's something in the contract about saying that you need to finish the medical school within the number of years that you have left. So you can't like retake a year or anything like that.
Elizabeth, you were saying?
Yeah, I was basically saying the same thing. You can't fail, basically.
Yeah.
Yeah, I think you don't get the grant. Yeah.
And they make it very clear as well that having the grant does not guarantee that you get a job. So basically they aren't giving you anything except the money that's promised. Yeah, that's all that's in the contract.
You mentioned that giving a person a grant doesn't guarantee them a job. Have you ever heard of an example of someone who has had the grant but has not been able to get a job in Singapore?
I don't know anyone. Do any of you? No?
Right. Okay. So regarding the penalty now of the contract, so what is the penalty if a PG recipient were to break the service bond and the circumstances in which one might consider doing so?
So if you break the bond, I think you need to pay back, obviously, like what they gave you plus 10%. So if they gave you like 50,000 or whatever the maximum amount per year is, then you have to pay back 55. However, I do have friends who like didn't take any money and then broke the bond. And then I think if you do that, you have to pay back 1,000. Is it 1,000, Rachel? It's 1,000.
Yeah.
Yeah, so that's kind of, and I think you may choose to break the bond, obviously, if you have other pulling factors. Let's say you find a partner in the UK or you want to settle down in the UK. I guess the main reason is that if you want to stay in the UK, you would break the bond for whatever reason. But yeah.
And in most contracts, usually there are guarantors. Was there guarantors that are needed regarding taking this PG?
Yeah, so I think my parents are my guarantors. Yeah.
Okay. So it can even be family to be your guarantors.
Yeah.
Just to highlight something else as well. So a common misinterpretation of the contract is, did it mention that the 1 year grant is 50,000, 2 year grant is 100? So the words is actually up to 50,000. So it's just depending on your school fees. So if you get a 2 year grant, it doesn't mean that you get 100,000. You get based on what your school fees are. For example, if it's 70,000, then you get 70,000. Some people assume that it's 100,000 just because they saw it as 100K, but it's actually up to 100,000. And then the liquidated damage, they'll tell you up front. The liquidated damage does include your airfare. If you're planning to come back for elective, they actually pay for your airfare, and that's also included in your liquidated damages as well. So they do tell you when you sign the contract right up the front how much your liquidated damage is, and then it's split equally among the number of years that you have to serve as well.
Yeah. And regarding signing the contract itself, is it something that is done immediately after the interview, or is it something that's done a week later, a month later? How was it for everyone?
So for me, they sent me. Oh, sorry.
No, carry on.
They
Just
sent.
carry on. Yeah.
they sent me an email like around a week after my interview saying that I was successful. And then they asked me when I was available to come back to Singapore to sign it. So they said, if you're coming back in December, you can sign it then. Or if you're staying in the UK for Easter, they will come down to do that as well. So you don't need to sign it immediately. You actually have a bit of time, like 2 to 3 months at least. So I think in the past it was you sign it on the day itself, but that has since changed.
So for myself, I think the time period between my interview and the results of the interview is about 1 to 2 weeks. And they gave me an option actually whether to sign it in Easter when they would fly to London, or to sign it when I return to Singapore, which I did. So from end of September to June was my duration of the time between getting the grant and officially signing the grant of the following year as well. Yeah, so it's quite a long duration that I had.
I think they're generally quite flexible with it. Sorry. Okay.
No, go for it.
I think they're generally very flexible with it. So like, if even for your guarantors, they're happy to kind of arrange another time to do it with them. So they're quite accommodating to your schedule.
Daphne?
Oh yeah. So I got an email as well, and some maybe said they'll fly over on Easter, or I could just sign it when I'm next back in Singapore. So I told them I'll sign it when I'm next back in Singapore, which I should be telling them now because I'm in Singapore, but I haven't. So I actually haven't signed it yet. They don't seem to be chasing me either. So I think it's really, you do have a lot more time to decide whether or not you want to take the grant as compared to the previous years, which is quite a drastic difference, I think, because you know, in the previous years, there's a lot of kind of having to decide on the spot, like, do you want to take it or not? So people will have to make the decision before you even apply. You should be quite certain before you go for the interview and stuff. Before our year, it was a lot calmer. I think because the number of PGs they're giving is kind of on the decline. So they basically kind of see everyone and interview everyone before making a decision. That's why I think everyone gets an email on the same time. And they only send out the like results of the interview after everyone is done. So like, it depending on when your interview is, it might take quite a while. Yeah.
Rachel?
Yeah, it was kind of the same what everyone said. They emailed me the results about 1 week later, and they're quite flexible with it. It kind of just depends on your schedule when you'll be back in Singapore.
I'm the same as Daphne. I'm just hiding out from them until I have to sign it. But I told them I'd sign it in August, so that's nearly a full year after the interview, actually. Yeah, so I'm still taking the time to think about it.
Okay, great. So now on question on second applications. Could I just take a poll if anyone was here a second applicant? That means you applied for the PG once, but were unsuccessful, and applied for it again. Is anyone here a second applicant?
Yeah.
Okay, so could the second applicants share on what you think was done differently in your second application, and what are some of the steps you took to improve your profile? Perhaps Rachel first.
Yeah, okay, so I applied for the second time, and yeah, like I said, I really think the only difference was that my interview was better. So like my CV was pretty much the same, but I think what helped was, like I said, I was a bit more comfortable in the interview because I knew what kind of questions they were going to ask and what the style was. And also my second interview was it was after my intercalated year, and it was during my 5th year, which is my second clinical year. So I think I had more clinical experience also. So kind of the range of cases I could talk about just was bigger, and I was just more confident in my clinical knowledge. And since I did an intercalated year as well, they did ask a bit about that, like what I did during my intercalated year. So there was a bit more I could talk about, just about the research that I did and what I was interested in. So that did help, I think. Yeah.
Yeah, I agree that knowing the interview format and what kind of questions they're going to ask definitely helped. In my first application, I was actually coming out of preclinical, so my intercalated year. So I basically had very little clinical exposure, which I think was kind of went against me. So applying in my second year, having the kind of clinical training that I had, knowing how to think through things, how to present things, definitely like helped in the interview overall, and like knowing how to talk through kind of investigations and tests and things like that. So I mean, it's not to say that you shouldn't apply if you're coming out of preclinical, but just to know that it's going to be a very clinical based interview and to be ready for that, I think is important.
Did any of you feel that you were not so prepared because on your first time of taking the PEG application that you were not able to come to grips with all the clinical knowledge tested? Do you feel that there were things that you were lacking in that?
Yeah, I'd definitely say so. Like in my first interview, I just couldn't answer a lot of the data interpretation questions because I didn't have the training. It was also hard for them to ask me about any cases because I basically did not have any exposure to that. And I guess like in the run up to the interview, I basically prepared everything based on my portfolio and my CV, which wasn't what they were looking at. So it was just kind of a mismatch between what I was expecting and what actually happened when I went there.
So like regarding preparation tips, this can be answered by anyone. So what are some preparation tips that you would share with someone who is right now wanting to apply for the upcoming interviews?
I think if personally for me, I just made sure to prepare one case really, really well. So make sure you like it, because they basically just ask you to start off by giving the history that you took from the patients. You can just start off with a history and then they'll just tell you, they'll ask you like what are the differentials. So obviously have a list of what you think it is, and then for each differential, make sure you kind of prepare as well, so that because technically they could ask you anything related to anything that you're saying. So make sure like you know what you're saying, and if you want to say something, make sure you like read up enough about it beforehand, and like make sure to really explore the topic. Because mine went from some like I was talking about breathlessness and like heart failure and aortic stenosis, and then after that it became like a whole talk about congenital heart conditions and things, which is like not even really related, but it's just kind of like cardiac related. So technically they could ask you like anything. So just, I guess, think more widely about the topic rather than being very narrow-minded and thinking like, oh, it's just signs and symptoms, diagnosis, management, because that's what I did. And in the end, they didn't really ask me that much about it. They kind of asked me a lot of like broader topics. So I guess in that sense, just think a bit more widely about possible questions or possible leading questions that they can ask you.
They do seem to ask a bit about kind of like clinical science as well, or like anatomy. So things like I was asked about like the blood supply to the heart, about anatomy around the thyroid, about blood supply to the thyroid, about like left recurrent laryngeal nerve palsy, that kind of thing. So I guess like anatomy and physiology as well.
The Oxford handbook's pretty handy. So I use the Oxford handbook, like what Elizabeth mentioned, for a lot of acute emergencies as well. It gives you an overview of everything like diagnosis, investigations, management, for example. And there are also resources online for libraries of data interpretation. Like I use Radiology Masterclass for chest x-rays, Life in the Fast Lane for ECGs, and ABG Ninja for ABGs. They just give you lots of different examples of data that you can use, which is also useful just for practice in medical school as well, which is quite handy. So in terms of cases wise, make sure you prepare a case that you are strong in, and prepare it from a very broad point of view. But just as for interpretation wise, just prepare just a broad cases, like anything can come up. it's hard to kind of predict what they can teach you, but they would usually expand on what they've been currently asking you, or your elective or your audits, for example. Yeah.
Yeah, I think like,
I think
sorry.
No, go ahead.
Okay. Yeah, so I think like Lizzie mentioned just now, it's good to just revise on the acute section, because most of the interpretation or most of the cases that they ask will be in the acute section. So like things like the different heart conditions, like ACS, maybe stroke. I've never heard of anyone that got stroke yet, but I feel like it's possible. I know someone that was asked about like cerebral edema and how to manage that. So yeah, so mainly just very, very acute conditions. DKA, what would you do? What are the classifications, I guess, as well. Yeah, because they asked me like, what are the 3 different like things that you need to diagnose DKA? So it was quite specific. Yeah, so just brush up on those, especially if like you haven't done any clinical years yet. Yeah.
I think another way that you could approach it would be the symptom-based approach, because they can do that usually as well, like asking you about your differentials for like chest pain or shortness of breath, or any kind of the main presenting complaint that you commonly get. So I think Oxford cases could be helpful. I guess it kind of varies from individuals how you like to approach your preparation.
I wanted to add, having a brief reading into pathophysiology of things is really handy, because it helps you to explain things in like full sentences and in words, rather than how we normally study, which is just in like buzzwords and things, which is really easy to see through. Like you just know buzzwords and you don't actually know anything about the pathology. So probably do some background reading on the acute medical conditions, just like 1-2 liners for each thing. You know, it really helps a lot to get out sentences.
So yeah, the questions regarding, so these are questions that came in from our viewers, and it's some of them asked, it seems most of you are studying in London universities. Do you think that plays a role in getting a PG? Other questions were on a similar note regarding, does the university you attend affect your chances of being a successful applicant?
Well, I'm not from a London university. I'm actually from Queen's University, Belfast, which is in Northern Ireland. And I'm not the only one from my university who has received PG grants before. There have been a couple as well. For example, Dean, who gave the similar talk that I'm giving right now. So I don't think university particularly plays a part, because they are also quite aware of the fact that each university has its own style, own learning difficulty as well. So I'm primarily focused on the interview rather than the external factors of where you're from.
Another question asked by our viewers is, did they ask anything about co-curricular activities like sports or music, or other involvements that you had in your time in university? It's like an open question to all.
Okay, this sounds like
Daphne first.
Okay, I keep interrupting people. Wait, no. Okay. Yeah, for me they asked. This sounds like some random like getting to uni question, but they asked, "What do you do to relax?" Like, so I guess in that sense they did ask me about co-curriculum. Yeah. So but I guess they don't really care about that. It's just more of like getting to know you as a person. Yeah. So I don't think you need to prep on that, and you don't need to boost your CV or like get a leadership position or something. It's just more of like knowing who you are. Yeah.
So for me, they just asked me about roles and like societies I've been in that I put in my personal statement. they just asked me a random question like, out of all these awards, which are you most proud of? Is it your sports awards or is it your academic awards? And then like before I could even answer, they moved on. So I don't think they actually really care. They just like, I feel like they're just reading your personal statement in front of you as they're asking you. So I don't think it's really like a big deal whether you're in a society or like have sports like leadership roles. Yeah.
So another question that is posted by our viewers is, could you give us an outline or the timeline of the whole application cycle from start of the application when you first applied in terms of like the month, I guess, and walk us through as the viewers to the very end of signing the contract?
It's like a memory game. I guess it starts off with just the basic application where there's a application form online in the MOHH website, and you also have to get your supervisor's assessment. There's a separate form just for a supervisor to kind of assess you as well, and then your school has to also give that official decile ranking or your percentage ranking, whether you're in top 10, top 20, or top 30 onwards, for example. And then after which it takes a while for them to process it. Honestly, I can't remember which month it happened, but they give you an interview date, and which mine was in September 2018. And then the interview happens, and then shortly after you get like a week or two later, you get the results, and then you can either sign it when they come in Easter or when you're back in Singapore, which can be weeks or months later after the contract. It's quite a brief overview, but honestly, I can't remember the months. But it's nothing too complicated, if that reassures you.
I think the application opened in June, and then around sometime in July or August, they'll email you asking for a reference. So just keep that in mind, like make sure you know like a consultant or someone that you can ask and is able to reply promptly, because I think that was an issue for some of us. We couldn't find someone on time. So around July or August, you send that, and then they'll give you an interview date in early September. And then, yeah, like a week after that, you'll find out whether you received it or not.
Sorry, this is the second last question to you guys. Do you know if the applications are open this year, given the current COVID situation?
I think
Honestly not sure, but I checked the website just now and it did say the information will be posted in June this year, so it seems like it still will be. Anyone else have any other info? I don't know.
No, I don't. But I don't see why they can't do a Skype interview.
Yeah.
Yeah, I think to the person who asked that, I guess, I think everyone's delving in a lot of uncertainty in this period, even all the SMS UK events in general. And I guess, it's best to check with the MOHH website. And I think if there's possible email there, you can always ask them about it. So the last question, just to wrap up this whole session, to be answered really by everybody, all the panelists. What is one thing, if you could say to a potential applicant, that you leave with them? Just one final piece of advice you leave with them, as it were, a parting word to them, to give to them before they apply for this PEG. Probably start with Rachel.
Okay. One thing would just be to think carefully about just think carefully about really where you want to work. I mean, because that's basically whether you will apply for the grant or not, and whether you will take it. Just think about where you want to work, the pros and cons, and I think talk to your seniors and your family and your friends as well when you make this decision. Yeah.
I would say just really find out more about what the system is like in Singapore, so that you have a clear understanding of what you're getting back into. if you do choose to go back. Yeah, don't be too idealistic about it, I suppose, but get a more real view, and then you'll be able to decide for yourself.
I think regarding the interview, I think you do have to prepare. You do have to like study for it in terms of like reading your notes or reading doctor's handbook, like acute section or whatever. And I would say most importantly is to like think quickly and a lot and think out loud is probably the most important thing. And just like turn your brain on and like just like you're trying to impress, so you need to just like give them as much knowledge as you can possibly think of.
And I think leading on to that is just don't panic in the interview, because they just want to see how you react to all the questions that is being posed to you, because obviously they're gonna be difficult and it's meant to stretch you and to see how much you can actually answer them. So it's definitely going to be difficult, but don't panic. And yeah, like what Elizabeth said, just like think out loud. They just want to see your thought process, and if you can just show them that you're thinking through their question and that you're thinking through everything in a logical way, like I think that's more than enough, because I wasn't able to answer like a lot of their questions correctly anyway.
Yeah, I think people have touched on this, but definitely have a system to answering questions even though you're not sure of the answer. So if they ask you about the treatment of AF, for instance, and you suddenly just forgot it, just like break it down. Is it acute AF, chronic AF? Are they stable, unstable, that kind of thing? Like giving headings like conservative, medical, surgical, that's always like a go-to that I use, even if I don't know the answer. So I think, yeah, just don't blank out. It's easier said than done though.
Bridget?
Yep, just adding on to what everyone's really said, I guess just be confident. It's quite a scary experience, but just don't let yourself be intimidated by it, and try to maintain a level of kind of calm so that you can perform up to the level that you know you're at, and hopefully it goes well.
Satish?
Yeah. So in terms of for the interview process itself, have a strategy, because they are very likely to ask you things that you are interested in or you have done. So prepare something that is robust and that you're very well knowledgeable of. Take time. If you need time to think, just tell them like, give me some time to think, because you're better off giving a better answer after thinking than to give a panic answer. They're not expecting you to be the next prof or registrar, so your knowledge is definitely limited at this point. So it's fine not to know answers, but have a good structural thought process of how you think, which will definitely reflect on what kind of doctor you'll eventually become as well. From outside the interview point of view, like some of our peers have mentioned, know why you want to apply for the PG grant, know the pros and cons of both the UK and the Singapore system, because reality is there are some specialties that are way more competitive to get into in Singapore compared to UK. The chances might be different as well. If you have the luxury of speaking to seniors who have rejected the PG grant, ask them why they've rejected it, and just make sure you know exactly what you're in for once you are willing to take up the grant. Yeah.
Great, and that's a wrap for this year's PG Talk. I'd like to thank all our panelists who have really taken the time and effort to be with us tonight, and I'm sure that they have really shared some stuff that have been helpful for those who seek to apply for the PG cycle. To our viewers, thank you for tuning in and sticking with us all this while. We wish you the very best in your PG application, and just really hope the talk tonight was useful for you. If there were things that you mentioned that were missed, don't worry, this session has been recorded, and we will be sending a summary of the points discussed by our panelists to you. So a feedback form will be sent and a link will be sent. It'd be great if everyone could just fill that in. It's not very long. And the email that you put there, you would send this document of those key summary points from this talk there. So we hope this talk has been helpful for everyone, and on behalf of the 26 SMS UK committee, thank you and good night.
Bye.
Bye. Bye, guys.
Guys.